Hi everyone. I had a woman message on one of the Facebook groups, and her question was, can we exercise if we have PAH, and does it help? So I promised her I would do a little video or just some information on this because yes, absolutely, exercise does help if you have pulmonary arterial hypertension. The thought used to be in the early days of PAH treatment when the medications first came out that PAH patients should not exercise because it was too stressful and put too much strain on our cardiopulmonary system. The findings now have changed, and the recommendation is that we do exercise. And there are a few reasons for that. The number one reason being that they found when patients didn't exercise, they actually experienced muscle atrophy and lost functional status. And when we talk about functional status, the main thing that we really see can be an issue with PAH patients because they're so fatigued, they're worn out, their heart's working overtime, is they have a difficult time doing activities of daily living. So I know for a lot of you, showering, vacuuming, especially cooking, things like that are just difficult and wear you out. But what we find with exercise is that as you exercise and develop more muscle tone, your muscles use oxygen more efficiently. And for PAH patients, that's the prime issue. We don't oxygenate properly, and activities make us desaturate very quickly. So anything that you can do that will build muscle tone and help you use your muscles more efficiently so that they oxygenate better and your system doesn't require as much oxygen throughout the day is beneficial for you. The second thing is there are hormonal changes that occur when we exercise. Now, there is a difference between women and men when it comes to PAH, and that is hormones. So women have more estradiol and men have more DHEA. Estradiol negatively impacts pulmonary pressures and drives them up. DHEA positively impacts pulmonary pressures and helps keep them down. So we see a much higher rate of PAH in women than we do in men. When we exercise, DHEA actually goes up quickly after exercise, and that's protective. It helps lower our pulmonary pressures. The other hormonal change that occurs is cortisol goes down, and cortisol is another hormone that is negative towards PAH and drives our pulmonary pressures up. So anything you can do in your life to help keep cortisol down is beneficial and will lower your pulmonary pressures. Because we know exercise releases endorphins as well that help us be happier, we're less stressful. With that lower level of stress also helps keep cortisol down. So we have all these reasons hormonally to exercise with pulmonary hypertension that keep our pressures down, and that is that DHEA is going up, cortisol is going down, and we experience just less stress overall as well. So all of those things in combination are beneficial if you have PAH. That being said, the number one thing you need to do if you decide that you want to start exercising and you have this disease is talk to your medical team before you institute any type of program. It's very important that you exercise under supervision, and whether that be that you are in the pulmonary rehab center or the cardiac rehab center at your medical facility, or you are speaking with your providers at your doctor's visits and just letting them know, hey, this is what I want to do, this is what I feel like I can do. They really need to be in the loop and aware of what you're doing and sign off on that. The key that I find when I exercise, and I really recommend this, is you need to exercise at a level that you can still hold a conversation. Because if you're exercising at a more intense level than that, you're driving up your pulmonary pressures to a level that may be a little bit damaging for the vasculature in your lungs or put too much strain on your heart. So make sure when you exercise, you can still hold a conversation, you're not worn out, you aren't feeling chest pressure or pain, and that your medical team is aware of what you're doing. So that is kind of the physiology behind why exercise helps us. If you have any other questions, you can leave them on either my personal Facebook page or the Zebra Lungs Chronic Disease and PAH Education page that I have, and you can just send me a private message as well. Thanks, and I'll see you on the courts. Bye.